Well, going into the session, it was clear to us that we wanted to make sure that physicians and patients were working together to come up with how do we create high-value care. And we recognize that this law, the Affordable Care Act, actually provides an opportunity for innovation that up to now has been stifled because of federal regulations against what we call anti-kickback laws and Stark laws. So I think what we were able to make sure that as we listened to the discussion back and forth is how do we align incentives so that people are doing the right thing, but also recognize that there is a role for the federal government to provide those safe harbors for us to evolve and improve our healthcare system. Well, two things. First, as we roll out information technology so we can have all physicians and hospitals in the United States linked so that they can share information, we can reduce about 20% of the extra tests and examinations, x-rays, CT scans that are being done because the physician doesn't have that information when the patient needs it. And the second thing, we think we can look at what we call defensive medicine. Defensive medicine is a process where a physician's concerned that they may be sued later on because a test wasn't ordered. If we are able to create a safe harbor so that the evidence-based practices, the Physician Consortium on Performance Improvement that the AMA has convened for the last decade that says, gee, if you've got this particular medical condition, these are the tests you ought to have, and you follow that, then you don't have to worry as a physician about being sued because you didn't order the CAT scan on somebody who came in with low back pain when the physical examination really doesn't suggest they need one. What's crucial is that communities where patients, physicians, employers, hospitals, the whole infrastructure, each community is going to have to look at how they best deliver that high value for that community. Some places are already pretty well integrated. Other places are very rural and are going to have to link in with other systems to be able to provide that information sharing. But at the end of the day, 50% of healthcare is based on choices we as individuals make. And so we are going to have to take a look at how do we incent our systems so that we are making good, proper health choices and keeping ourselves healthy, because ultimately, if we are going to make it affordable for all Americans, we're going to have to make ourselves healthier. Well, the advantage of the Mayo Clinic has by hosting a symposium like this is it's the private sector bringing together the public sector, payers, patients, physicians, in a safe place to have a discussion and an honest interchange about what's needed without the rubric of politics. And I hate to highlight our American system as being a problem, but in some respects, sometimes we don't have the civil discourse that one would hope that our democracy was founded on, and our democracy will need to continue to have as we face some really difficult decisions on how do we make healthcare affordable for all Americans by getting rid of the unnecessary costs in our system. It's clearly an honor for the American Medical Association to be here because we believe, representing as the largest physicians organization in America of all the specialties of physicians, that we do need to focus on how do we keep our patients first and providing that patient-centered care, because at the end of the day, one of our ethical tenets talks about making sure that we always make the needs of the patients our top priority.